Hello, everybody. Welcome to the panel on COVID-19, one of two panels that we're going to have here today. We're excited that you were able to join us and participate in our last session on social entrepreneurship. Today, we're excited to have some great conversation going on with our panelists. First, we have Shannon Lancaster from Arizona State University. We have Sean Frazier from Northern Illinois University. And we're excited that you're both with us today. COVID has been a crazy time for everybody. We're going to start with Shannon from a medical perspective in terms of what you've seen from a university side of things. When this first popped up, you had to move pretty quickly to get things pulled together, right? We're playing conference basketball tournaments on Wednesday, and then the world shuts down, the sports world shuts down on Wednesday night and Thursday. So talk about what that was like at the beginning.
Yeah, so, I think we were really lucky here at ASU. We were uniquely prepared because a lot of people don't know this, but we actually had one of the first cases in the United States. So we had a case actually of someone who had traveled from China who was diagnosed actually in early February. And so this was we were talking about this as a medical staff, and we were talking about kind of the potential ramifications relatively early on. We've got a great student athlete advisory board. And so they even requested, hey, we're hearing about this thing that's going on in China. Like, can you come talk to us about it? Do we need to panic? Do we need to worry about this? What is this? And so this was actually back in kind of February that we started these conversations. So we actually had kind of a foot out the gate before we even knew what a big thing this was going to be. But you're absolutely right. I had just gotten back from the women's basketball championships, and staff and parts of our department were in Las Vegas for the men's basketball tournament, and all of a sudden it was like, hey, like this isn't going to happen. And some of actually our travel staff got stuck. They couldn't get back because of like different things that were going on. And then it just moved really so quickly. And then seeing, how kind of this wave happened in the United States in the early spring that really affected the East Coast primarily. And just kind of moving things, getting lots and lots of education, because as we're learning different things are changing too. Initially back in February when I talked to students, it was like, hey, you probably don't need to wear masks based on what we know about this virus. We probably don't need to do it. And then, a couple weeks later, couple months later, things are just 180 degrees different. And so it's been a practice of being patient, of being nimble, and of accepting change, which sometimes can be really, really difficult.
Yeah, it's interesting because as you talk about that first month or 2 months of COVID, it seemed like the rules and the guidance was changing every 72 hours. We had new information. People were trying to throw everything at the wall and figure out what might work and what might stick. And there was a lot of challenges because one day you're being told don't touch anything. The next day you're being told don't wear a mask, do wear a mask. So as you're trying to advise the student athletes as they're going through that, how do you create a message that's consistent without telling them, well, wake up in the morning and read your email and the new guidance will be out at 8 o'clock every morning to tell you how to live that day?
Yeah, it's been a challenge, and I typically start off any conversation with what we know right now is this, and it's likely to change, to get people kind of ready to expect that there will be some modifications in what we do. And then it's just about access to student athletes and their families to talk to them. So thank goodness for technology. because, back when I was in college, I don't know how they would do this and probably put, posted signs on everyone's dorm. But thank goodness that we're able to get large groups of people through Zoom, so that people know what the expectations are. They know kind of all of the work that we've done to help prepare for student athletes returning to campus and in preparation for competition. It's been actually fantastic, just because from the medical side too, it pushed us more into telemedicine services, which is just, it's better for healthcare.
I think it's interesting when you talk about that communications issue, because if you think about what would have happened if it was in the days, not only before Zoom, but let's say before email and cell phones, how challenging it would have been to try to have these conversations, not only things like what we're doing now as a conference, but Shauna, you talk about a whole athletic department and think about how you need to communicate. It's not easy, even with all of this technology. Um, Talk about those first few days when you saw COVID really pop up, and March 11th, when the first set of games started getting called off, fans were blocked from the tournaments, and then the tournaments were canceled and the next morning. What was that like from an AD's perspective?
Yeah, it was interesting. I was just talking to Shannon about that. It's interesting. We had made it. Our men's basketball team had made it to Cleveland, where our tournament was being played. Mid-American Conference was being played, and it was interesting. Leading up to that, we had all these Zoom calls, all these calls, conference calls about not having fans at the tournament. And that we were going to deal with it from that, and only essential personnel, and we were going to limit all that. So going into it, we knew this was going to be a different tournament than what we were used to. We actually had earned a first round bye into the tournament. First time we've done that in a long time. So we're really excited about our ability to compete there. So we got there the night before. I think NBA was on, and while we were watching the game, they canceled. That was the night before. So that was the watershed moment that, I turned to a donor friend of mine that we had made a trip together, and he just said, "I think we just saw the end of basketball." And I said, "What?" I think this was it. The NBA's not going to go on, and we're going to stop playing. What makes you think this is going to happen? So it spudded into this pretty much exactly what happened. We get up in the morning time, we have a number of meetings with presidents and the commissioner, and what happened from there. I had to address our team that we were going to cancel the tournament, and that was the sober reality of what the impact of this, and it changed everything. We put the teams on a plane to go back. I actually had driven to Cleveland with a friend of mine, and then on the way back, you saw the involvement of all the things that were going to happen, the shutdown, the sanitizing, the testing. It was rapid. And at that point, really didn't know what the far-reaching effects were they're going to be. But we did know that the things that we do from an operational standpoint, we're not going to be face-to-face. They were going to be limited. We were having, conversations about lockdown and let's see how long this is going to take. And then before you knew it, we were in this kind of world of video chats and everything that we're dealing with right now. It has changed everything. It's been decimating to any type of organized meetings or events at all. It's just complete shutdown. It forced us to have to reimagine how we interact with, quite frankly, our constituents, both our students, our staff, our donor base, our alumni, and it was a bit of an apocalyptic type event where, I went into my office and I kept my blinds open, and it was almost eerie because everything was in the exact same spot. I had not come into the office at all because everything was on lockdown from the university and everything else. So you see the edges of dust and the yellowing of the paper and all that. It's almost like I was never there. So yeah, it's changed everything, and it's definitely moving forward. The intentionality around our plans moving forward. It's about this tactile world, this virtual interaction. So all the decisions that we make now are predicated on the virtual space, the non-face-to-face, which has affected everything from an operational budget standpoint to everything that we do. So long-winded response to you, Roy, to say that yes, this has changed everything.
It's interesting when we look at it, right? We think the world moves along and we think the plans are in place, right? You spend a lot of time planning for your year as an athletic department. You start thinking about how things are going to be handled. You've got, crisis planning, emergency planning, but I don't think on March 1st, anybody had any type of plan in place for a pandemic of this scale and certainly for that speed. You look now, looking back, right? We're almost 8 months into this now, and look at what's gone on. And you had a lot of time, Sean, over the summer to evaluate what was going to happen with sports. Again, it's challenging because the guidance maybe didn't change every 72 hours, but there were still significant changes every 7 to 14 days in terms of what the medical community was finding out. How did you go about that planning process and really balance the different needs that are out there? Because you're talking about the health of the athletes, number one, and I know that's of primary importance, but you also have to protect the coaches, all of the staff, the medical providers at the university. You have to protect the institution itself in terms of liability issues and risks. How did you form a plan to address those issues?
No, it's a good question. It's like a lot of other institutions. We had our classic COVID response plan, which was morphed from crisis plans that we have as a part of it. Say we had a major storm, or we had some type of unfortunate action that necessitated having police or law enforcement involved. So we've had some of those plans that were in place, and we had to modify them significantly. And I think that the big thing with us is that we leaned heavily on our healthcare provider that administers our docs and our clinicians, Northwestern Medicine, which thank God that we had a network that was really powerful to be able to at least supply the experts to talk us through what we were facing. Okay, there was a lot of misinformation about maybe COVID being a glorified flu or something that was not as intrusive on those lines, because again, we didn't know, right? This thing kind of crept up on us, and even the experts were saying we just don't have enough data to really know what this means to us, both both on the virus itself as well as on the individuals in question. We did know people were dying, and we did know that folks were getting massively sick, and in some parts of the country it was really bad and still bad, quite frankly. I think that what we did is that we wanted to lean on the side of caution, and thank goodness for our president, Lisa Freeman, who led the charge. She's a medical doctor herself. It's always great to have leadership on the top that observes that. So having her expertise, and then just in general leaning on, again, Northwestern Medicine and our team docs that were helping us through this. And that came down with a significant decision before anyone else in the country. I could say that is that we shut down fall sports specifically, and football specifically. And that kicked off a chain reaction of such. But it gave us the chance to be able to put a protocol in place that really that we stand by, and it is aggressive. It is definitely speaks to safety first, but more importantly, it's learned from the brief amount of time. You just talked about 7-8 months. Think about a virus and trying to come up with a vaccine and all these other things. These things take years to do, and I think that people just wanted to, they went back to normal versus understanding the impacts, both short-term and long-term. So by having that pause, and we paused for obviously going from March to all the way to we haven't even played a game. We're getting ready to play a game here November 4th based on our MAC protocols. And it was a significant opportunity. And there was a lot of moaning and groaning, a lot of people feeling like, that we were being a little bit too cautious. But I definitely stand by the experts and our docs for making sure they were navigating us, because I still don't know. In my own personal life, my family, my wife's side, we had lost people to this disease. So again, for me, it was really more of an opportunity to safeguard our staff, our students, our community. And we still are dealing with a number of things. And I was talking to Shannon about the fact that we put a very robust protocol in place. We test four times a week, 2 consecutive, 1 after, and we're antigen testing. And then if we test positive, we go to a PCR test. So there's a lot of different factors with the cardiac review and all the things go on with that. I'm not a doctor, but I feel like I play one on TV now, having been involved in so much of the protocol. But I do believe that those things are necessary to at least understand and give folks the opportunity to opt in or opt out. We're also giving our kids and our staff to opt out, to not be around and not to do those things. So this is a war. And I think it's important for us to respect what COVID-19 and the things that are going on with that, and also to safeguard the best of our ability.
Well, there's no question that the issues continue to arise. Shannon, as you look at that time frame, then right, March and April were sort of triage months of figuring out like what do we need to do just to truly stop the bleeding and get this contained as best we can. You didn't really have time to plan. We heard all the talk about the heat is going to kill off the virus, and we see clearly that didn't happen. So now as we look from your end over the course of the summer, school shuts down, right? Then you go over the course of the summer. What are you looking at in terms of your planning, and how do you think that worked from a perspective of an organization and university in terms of what your role was in guiding what those policies and procedures should be?
Yeah, well, and I think some of the challenge too early on is that the NCAA they were pretty swift. Probably not as fast as some people complain about, but I think they were pretty quick in saying, hey, like, this doesn't make sense to do this right now. We need to shut this down. And I think the bigger piece of confusion for some of our Olympic stream athletes was that Tokyo 2020 was on. And so we still had people that were trying to figure out how to train, in swimming, in wrestling, and a lot of these other sports that really just became really tough, because at that point we just didn't know much about the virus at all. And so it was challenging for sure. And then, then as soon as we knew things were shut down, then it's like, okay, well, how can we start to plan to bring things back? And so, I mean, I would say the majority of my summer was spent reading and learning and trying to get protocols from Bundesliga, which was, I think, the first real professional league to return, and try to get those things translated from German to English so I could make sense of it. And then, collaborating with other groups across the country and really across the world to figure out, okay, what do we need to do? Like, can people use a locker room? Can people use a shower? Can, restaurants are closed right now. So how do we feed our athletes? What makes sense? Does everything have to be grab and go? Or if we spread things out outside, can we make things work? And so, a lot of working hand in hand with our public health directors. The piece that a lot of people don't realize is that in the time of a global pandemic, it's actually not the CDC that's in charge. It is your county health department. And so working really closely with them to figure out protocols and to figure out ways to do this safely. For a while in the state of Arizona, gyms were closed, commercial gyms were closed, and yet we were allowed to remain open because we had such a plan. And we were able to go to the county health department and say, hey, this is what we're doing to keep not only our community safe, our ASU community safe, but also the community at large. And I think there was a lot of grumbling in the community about like, well, why do the athletes get to work out? That's not fair. And it's like, well, there's a lot of pieces. There's a lot of things that are going on in addition to really help keep everyone safe. And it's been a process, and it's been lots of learning and lots of adjustments along the way to do what we're trying to play sports in a pandemic, which a lot of our infectious disease colleagues are like, there's no way you're going to make it work. But I'm cautiously optimistic that I think we're well positioned to get through football season, a basketball season, get through potentially some spring sports come January, and just keep sports moving, just because it is such an important part of normalcy. And watching sports on TV, I think, is comforting for people. I think we saw that early on with as sports were coming back, that TV viewership was way up, which is, it's a great thing.
Yeah, I think the challenge is, as you said, how do you balance those particular needs, right? So you talked about fairness. One of the comments that comes up about fairness is when there's a shortage of testing and a shortage of resources, why are the athletes getting tested 4 or 5 times a week every day in some of the leagues when there initially, right, there was a shortage of tests completely and people couldn't even determine whether they had COVID. I think that the whole issue of balancing those needs and the risks, because if you're going to go from a pure risk perspective, right, as you said, infectious disease specialists, right, there's no question if you're trying to get to zero, the response is don't play, right? Stay at home, stay in your bubble, and don't play. But what's interesting to me when you look around society and you balance everything we do is not only with sports, but with the world, with business, with education, with everything like that, we don't take zero risk as the goal or the model, right? We go out and we drive every day. People are killed on the roads. The idea is that where do you strike that balance? If you choose not to drive because you're scared of traffic or you don't feel comfortable driving, you can choose either not to drive. You could live somewhere in a city where you don't need to drive a lot. You could choose not to drive on the highway, not drive at rush hour, right? With COVID right now, we really don't know what those equivalents are, right? So Sean, as you're looking at the decision when you balance everything now to reopen for football, you, as you said, were the first to really make the announcement to back away. What changed? What was that balance of interests that changed that decision for your school and for the conference?
Yeah, I think it's a good question. I get asked that pretty directly about it, because I think that's important. What changed was the rapid testing, the ability to understand and to prevent the spread more so than to stop COVID. But I think that at the end of the day, we still don't know the long-term effects. I think that's fair. I think it's a fair commentary. But we do have enough technology and know-how based on what our medical experts have told to us to be able to find out at a very quick rate. I'm a part of the process now. I'm in the so-called team bubble of testing, and we can know within 15 minutes at a 98% or 97% percentile if I have COVID, and then I back it up with a PCR testing to confirm. So what that does is it isolates the opportunity to spread, or gives us more of an understanding about who has it. Now, getting rid of it and stopping it, that's a whole nother situation. I think our infection doctors will have to figure that out in the long haul. But the decision came down to saying that we had enough information instead of waiting for weeks or days or what have you to see if someone actually had the virus. So I think for us that we felt comfortable, and I hate to say it this way, watching other leagues and colleagues go through this. We had a month and a half to sit back and watch and they became our laboratory of what to do and what not to do. I call it the good, the bad, and the ugly about what was happening. And I think we needed to have the ability, I know I did, to be able to say that this was safe, is to kind of watch our different leagues or different colleagues across the country kind of fumble around with this a little bit. So I think that for us, that data, that understanding, along with our docs and our medical advisory group, to say, okay, this is what we feel comfortable in doing. This is how we can ensure the fact. And then access to the testing and then the information around that. You know, when this first started, it was taking a week. It was taking longer to even know who had what. So I think all that, when we put that into the blender, and then, you know, we came to the realization that we could at least mitigate the risk around this by having this particular protocol. And that made our president, who again, so she's a doctor, and then others, to say that, okay, if folks want to opt into this process, they can, but they're going to have to sign on to this particular protocol, which is extremely robust. So that's how we got there. Do I feel that there's still a certain amount of risk associated with this? Absolutely. Do I feel that we have more information since the date that we went on record to say that we were going to not have any competition? Yeah, I think that we're in a better place as far as safeguarding the young people and our staff to be able to do that. But we're very vigilant. We're watching the Midwest. We're watching what's going on with COVID. Yeah, there's lots of sleepless nights around that. And as we keep on getting test positives and constant other types of things that are happening all around us, we're very mindful that we might not get this season off or have competition by virtue of our pretty robust protocol. So we're crossing our fingers and hoping that we can move forward.
So Shannon, as you look at what's going on at Arizona State, what have you seen this fall as the Pac-12 prepares to get ready to go back to football? We'll come back and let Sean give us that same answer. But how often are your athletes tested, and what has the process looked like now as you get ready to dive back into fall sports?
Yeah, so again, I think that the difference in the Pac-12 was the availability of the rapid testing conference-wide. You know, because you can do everything great for your team, but if you go and compete against a team that's not, you don't know their status, there are some concerns. And we are tremendously privileged here because we have the ASU Biodesign Institute has created a saliva test. And we get results back in about 24 hours. So this had an emergency use authorization. And so we've been using this. I think our first cohort of athletes coming back in June actually had to have the big swab. And then kind of a couple of weeks later, we shortened to the short swab. And then maybe a week later, we've been doing saliva ever since. So that's fantastic. Plus we have access to the lab as far as the viral load numbers as well, so that we can actually track those with repeat positives and kind of all this other stuff to really medically manage it a little bit more. And so we've been tremendously privileged to be in that situation. So when the Pac-12 announced the partnership with Quidel, and it's a larger research project that we're involved in right now, we're testing student athletes 6 days a week, and we're testing staff twice a week. On top of that, we're doing a weekly PCR. And we actually may move into doing 2 PCRs as football season starts off, just to try to get a little bit more information. Again, you know, in medicine, we like data, right? We like data that typically are these huge research studies with tens of thousands of people. And we just don't have that right now with COVID. You know, initially when all these heart risks started to be mentioned, it was, 70 patients in Germany that had evidence of myocarditis, and that kind of threw the medical world into a tizzy, because they're like, oh my goodness, how this is horrible. Like it moved away from, worsening risk to absolute prevention. Like no one should get COVID if this is the effect. And then, a follow-up study out of the Big Ten out of Ohio State was it's 26 athletes. And so we're dealing with very small numbers. And in the end, once, everything is studied, those numbers may improve, and it may turn out that, and I have this conversation all the time. I was like, in 5 years, we may look back and be like, you know what? We just didn't know. We were doing the best we could at the time, but we didn't know. And that's not a big risk now. But for right now, I don't think anyone is willing to be cavalier, especially when you're talking about student athlete lives. And the risks of the heart conditions moving forward, all of that is just of such concern that you have to be conservative in a way.
Right.
But moving into football season, which we're on the 7th, and so yeah, I think it's a pretty, athletes that have been here through the summer, they're ready to go. And so it's just tough though, because sometimes with this age group, you're dealing with a lot of distractions, and distractions come in girlfriends and friend groups and other people that aren't being tested and don't know their coronavirus status. And so it's just, the motivational interviewing about why making these life choices that in the moment can be really hard to make. But if we want to play football, we all have to sacrifice a little bit.
So you guys have covered a lot of ground, and as you said, by definition, right, and when we don't know how to assess the risk, we don't know whether we're overreacting or underreacting, right? And we could look back at this a year now, 3 years down the road, 5 years down the road, and we'll have a much better idea of what the proper actions would have been at this time, but there's no way to know that now. So I'm going to pit the two of you against each other for a minute here, just based on your roles. I don't think it's going to be that adverse, but you come at it from different perspectives. So, I'd like each of you, we'll start with Shannon, to talk about from your perspective, the guidance and the input that you get from the athletic department staff, from the top, from the AD. Ray's over there. He's been around sports a long time, with the Falcons, with the NFL, with being an agent. So he certainly understands a lot of the risks, right? There's a lot of people that will tell us fairly accurately, maybe, when we look in the long run, that the risk of playing football is much more severe than the risk of COVID for most of the athletes in this age group, but we may not be able to assess that. So how much pressure or input or direction, whichever label you want to put on it, do you feel that you get from above, pushing down on what the guidance should be?
I think, again, I'm just very, very lucky to be in the situation that I'm in. I think Ray Anderson, our AD, is spectacular, and he gets it. And at the end of the day, we all have the same goal. We want to win, and we want to do it the right way with healthy and safe athletes. And so I think understanding, so yes, there's always going to be disagreements, but I think understanding that we both want the same thing just helps. We're just coming at it from a different way. So it's been tremendous because, I think the understanding that hey, I don't have an answer. I'm going to try to get an answer. Let me talk to county health department. Let me talk to leadership. Let me talk to other people and try to figure out a way that we can do this. And then, sometimes the answer just is no, which that stinks, and no one likes to hear that. But I think when you come at it with the understanding that everyone is trying to find a solution, no one's saying no just to be mean. We want to see the same thing, and like Sean said earlier, we live in a society filled with risk, and every time you suit up and get on the field, there's risk of injury, of communicable disease, of infectious disease that exists. Just a quick story. I was a gymnast in college, and one of my teammates at the end of my freshman year developed meningococcal meningitis. And so it's a tremendously devastating disease. And, she actually was one of the lucky ones that survived, but she is an amputee because of side effects from the medication and just the devastating nature of the infection. And, she was, at that point, she was a college student preparing for finals. And there's risk everywhere that exists in society. And I think most athletes understand that. I think the difference with this one is that we just don't know what the long-term effects might be. And so that the opportunity for athletes to opt out, if it makes the most sense for their families, really, I think is a smart thing to do.
Sean, from your end, um, you look at it, obviously you've got a big picture perspective on trying to balance all of the things. The athlete's health, obviously, I know is paramount in your eyes, but as you balance the other risks and you balance the medical assessments, where do you take that guidance? How do you evaluate all of that to reach your ultimate decision?
Yeah, it's about the health and safety piece. A lot of folks that would like to compartmentalize it to money, and I think that money has a place, it's a tool. But at the end of the day, that the biggest pressure that I have is to making sure that I don't put life in harm's way. So for me, I'm not a doctor. I don't know anything relative to that side of the house, other than the fact that I get my yearly checkup. I make sure that I'm doing the best I can, but I really defer that to people who know. You want to surround yourself with people that have the expertise. And in this particular area, this was about making sure we safeguard human life, and not just our students, our staff, our community, the people around us, our own family. My wife, who's asthmatic, who I can't bring COVID home to my house. I can't do it. So all these things are factors for me to say that let's do the best we can to make sure that we put the situations in place that safeguard human life. And let's start, day one with that by getting the best information we can. So once we got that information, and the reason why we were steadfast in our decision here in the MAC, in our presence, in our medical advisory group, it was to say, oh, we don't know, and I think that that's where we hit the pause button at the right critical time. So we could get more information. So folks could catch up to the testing and the things that are necessary to mitigate, again, the risk. So I think that, somebody asked me, said, were you pressured not to be last? I said, no, I was pressured to save lives. And I'm still dealing with that right now. So there's no more pressure in the world. I've been blessed to be in some situations where it's, it's do or die. And in this situation, it is do or die. So I have to make sure that we do the best we can and get people around the table that know about this. And we just don't have the breadth and depth of all the information right now. And I think that's why we're at a disadvantage. We will. And just like Shannon said, we'll probably look back at this and say, you know what, we probably should have did this, and that instead of that, this, and this, because it's kind of learn as you go. Someone had said to me that, we're flying the plane, but we're also trying to put it together at the same time. It's very appropriate. We just got to make sure that we get that landing gear together so we can all land together. Mm-hmm. So I think that's really what we're dealing with COVID-19, kind of flying at the seat of our pants and hoping and praying that we're making the right decision.
Well, and I know you're going to go ahead.
Strap those parachutes on. Oh, yeah. Just in case that landing gear isn't set.
Well, and it changes, as you said, we talked about the guidance. Maybe the guidance isn't changing, but the student athletes are not living in a bubble. You're not able to do that like you did for the NBA and the NHL that were successfully able to execute the bubbles. You see Major League Baseball had some struggles early on. You see the NFL still ongoing because guys are not maybe as careful as they should be. It's not realistic to think that it's not going to happen in college. Sean and I have the Wisconsin connection. And so, you watch Graham Mertz put lights out performance on Friday night, and then now coming down with the COVID diagnosis, and then the quarterback behind him has COVID. And then you look at what the relatively low threshold and long waiting period that's set by the Big Ten really impacts that as well, because I think it's a 5% rolling average over a 7-day period in the Big Ten. How does that look in each of your conferences from the the average, where that needs to be, and then we'll do that as a quick wrap up as the last point here, and then how long are the players held out?
You want to take that, Shannon, first?
Sure, yeah. So here, we're essentially following the CDC guidance. Our county health department really endorses that. I think the only difference is that our close contact, as we're doing contact tracing, is 10 minutes or greater rather than 15 minutes or greater. But other than that, a positive is out for 10 days in isolation, in strict isolation. And then we're following a total of a 14-day convalescent period, which is really because of the heart risk. And then after that, then they're evaluated for full cardiac clearance. And our best practices within our department and within our conference is 5 criteria. It's asymptomatic at rest, asymptomatic with mild activity like stairs and walking around, a normal EKG or an electrocardiogram that looks at the electrical rhythm of the heart, a normal high sensitivity troponin. It's an enzyme that's released by the heart if there's any damage to it, and a normal echocardiogram. And so we have an extremely robust process. If any of those things are abnormal, or if there's any clinical suspicion, then we're doing a cardiac MRI. For our affected individuals. So it's been learning a lot. There's times that I feel like I'm a junior cardiologist as we work through this, and we've got tremendous consultants that we've been working hand in hand with throughout this. And so it's going to be an interesting football season. The way our schedule is set, we don't have bye weeks, and so we've been pretty lucky. Certainly, we have 1 or 2 numbers, but we've been pretty lucky in avoiding a huge outbreak. So it again, it's the question of really how does this transmit, and is there a huge transition risk through sport? Just answers we don't know yet. And so being conservative, following the CDC, following our county health department, and trying to get through this all.
All right, Sean?
Yeah, it's very similar. 10-day quarantine. We're also doing a cardiac evaluation that must be completed, prior to medical being cleared. It's very, it's almost the same. CDC plus obviously the robust nature of sitting out. We're also using, greater than 5%, and our team party about 7.5% positivity rates that we use to determine a cancellation or postponement. So it's all the same, but it is robust. They'll be sitting out, minimum of 14 days, no matter what, based on return to play, and we stand by that. I just think that we'll test 4 times a week, and 2 times consecutive, 1 right after the game, and then that will determine where we are. If it is because it's antigen, and we do get a test positive, we'll have to get a PCR to make sure we confirm. So again, we want to make sure that we're doing everything we can and not hold people out, but at the same time, make sure we prevent the spread. So yeah, it is robust. And you had mentioned the Big Ten. It's, I stand by their policy. I thought their policies were, up front, center, and they give options, and the folks that don't want to opt in, we've had a few who have opted out prior to being involved with this. They can't opt back in, so it's one of those types of scenarios where, this is to protect folks. So it is robust, but at the end of the day, it's the best we can do now to safeguard our young people and our staff.
Well, Shannon and Sean, I want to thank you both for being with us today. Before I let you go, I'm going to put you both on the spot for one last question here. Okay, and no, you have to answer. We'll start with Shannon. If you had to pick right now, when is the next Arizona State sporting event that is going to have full-scale fan attendance?
Oh, full-scale fan. I'm going to say fall of 2021.
2021. Okay. Sean?
I'm going to say the same
for
thing.
Northern Illinois, not for Arizona.
Yeah, I know. I know. Yeah, Shannon doesn't want me talking about that. But no, Ray wouldn't either at the same time. But no, I would say definitely fall. We're looking at fall, and I'm hoping, I'm knocking on wood, because depending on what goes on in the spring, yeah, I think fall is probably more realistic. Maybe even late fall, to be perfectly honest with
Well, I hope both of you are right, because that's the most optimistic answer I've received in a while. I've got a number of pro sports teams and venues that I'm hearing are preparing basically for January 2022 opening with fans. And so, you know, Chicago Public Schools has told a lot of people not to expect full-scale operations without these restrictions until, you know, just a couple months ago, they were saying 18 to 24 months. So, you know, that would be more like fall of 2022. So I hope you're right. Thank you both so much for sharing your insight today. I know you've both got other panels coming up, so we're going to give you a few minute break here, and thanks so much for your time.
you. Thank you very much.
Yes.
See you soon.
Thanks for having me.
Take care, Shannon.
Bye-bye.
God bless.